In my 30 years in the skincare industry, I have found that people tend to ask the same questions. In America, unfortunately, people tend to follow the same path. First, they go to a drugstore, then a cosmetic counter, and then to a dermatologist, skipping estheticians altogether. In my experience in the medical, cosmetic, and spa industries, I have found repetitive questions, and really skincare is very simple. So today we're going to answer some of those most popular questions and break some skin myths. European women are known for their beautiful skin, and their grandmothers were getting facials. To them, seeing an esthetician is nothing different than how we would consider seeing a dental hygienist. It's just part of basic body health care. It's not a luxury, it's nothing fancy. It's just more than what you could do at home and based on skin health, working externally and not focused on disease as much as preventative medicine. So a couple of things I've heard along the way. Skincare is expensive. It's really not. But if you're buying a lot of product that isn't working, it most certainly is going to be expensive, especially if that product is creating more problems than it's helping. Really, if you just stick to that basic plan of 3 products, cleanser, moisturizer, and serum, and you use them until they're completely finished, we're talking about $100, $150 as an initial output. And then that product should be lasting you about 6 to 8 months. I'm used to using smaller amounts of very quality product, and it lasts me actually over 9 months. Another thing that I quite often see is these skin regimes or rituals, which you really don't need to have. Skincare should take you less time than it does to brush your teeth. It's just really important that you get the right product with quality ingredients. I also hear a lot about soap and how it doesn't make a difference what you use. I actually had a physician one time tell me that. My response to him was, well, then use bar soap to wash your hair because it doesn't make a difference. Or use dish detergent because, again, it doesn't make a difference, right? But it really does. And it's not really the soap that's a problem as far as the form of the product. Again, it's the ingredients in the product that creates a problem for the skin, stripping the oils, creating a surface film, and drying out the skin tissue. And then I hear people highly recommending skin oils on the skin tissue. Now that's not altogether bad. Again, think of it like your hair. You want a deep condition every once in a while, but you wouldn't want to use a deep conditioner every single day. And on the other hand, people like to use alcohol or things that create a squeaky clean surface on the skin. I do not recommend that you ever take that wonderful natural glow off of your skin tissue by drying it out with an alcohol product. You want to remember that the important things with the skin is hydration and a smooth texture. Again, I hear about cold and hot water. Yes, it makes kind of a difference. Cold water, obviously, anything cold will help to reduce the redness and the blood flow to the surface. And then warm water will help you to accept some product in a way. But remember that your pores don't really pop open and slam shut. Basically, a cool to warm temperature on a regular basis is probably more of an important way to go. Nothing too extreme, not too hot, not too cold. Kind of the Goldilocks idea. Another thing I hear is that you just need to let acne run its course. Again, I never, ever, ever would recommend that you let acne run its course. It will create scarring and it's an unhealthy state that really needs to be addressed, whether it's teenage acne or menopausal acne, which will quite oftentimes happen around the hairline. Another thing I hear is that there's really nothing you can do about your skin. It's all genetics. Granted, most of your skin and your entire body is genetic, but you can make a difference. They say about 5 years. I really say 10, because you could look 5 years older or 5 years younger. Another thing I hear is shaving, waxing, and using a personal groomer will create more hair growth and the hair to come back thicker. That's an old wives' tale. That comes from teenage boys growing thicker, longer hair naturally, and it's hormonal. If anything, when you continue to pull the hair out by the root, it damages the root structure and it grows back thinner. I hear that you cannot reverse the signs of aging. Again, that's not true. We're constantly creating new cells, and basically, if you give the body what it needs, it builds better. Again, another thing I hear is that there's nothing you can do about scars. It's not true. There's a lot you can do about scars. From facials and serums to microneedling to microdermabrasion, and there's been beautiful, wonderful things that have happened in the tattoo industry with scar revision. I'm going to break this down real simple. There's 3 categories in the skincare industry. We have cosmetic, which is makeup that goes on the surface of the skin. I do not recommend that you buy your skin products from the beauty industry. Generally speaking, they're only interested in things that go on top of the skin, and quite often their products will have a silicone base to them or too many preservatives that will cause a problem for the skin tissue. Then there's dermatology, and dermatology deals internally with disease through surgery, medication, or skin treatments. Quite oftentimes, those treatments are meant to create new skin tissue by slightly traumatizing it and causing the skin to regrow better and faster. And then there's the aesthetic industry. We're interested in creating healthier, more vibrant skin tissue by doing treatments and procedures that you can't do at home, like a dental hygienist. You wouldn't want to have a deep cleaning once a week or every day. When it comes to skin issues, my recommendation is that you see an esthetician first. Look for someone with a medical background, and then anything internally such as cystic acne or anti-aging treatments, see a dermatologist for something like laser or other skincare treatments that an esthetician's license does not qualify them to do, and I would never recommend that you see an esthetician for anything that would penetrate or create blood on the skin surface. Sometimes that happens with some light extractions, but you should never be over extracted to the point where you're puffy and sore for hours or days after a facial. If that's happening, you really need to seek out another esthetician. Another question is, how can you prevent skin aging? In order to slow down the skin aging process, you need to do a few things on a regular basis. First and foremost, you should use a sunscreen every day. My recommendation is that you use both a chemical and a physical sunscreen. You know if it's a physical sunscreen if it has minerals in it like titanium dioxide. When used in conjunction with each other, it's similar to putting on a sweater and a windbreaker. It's a way to protect the skin twofold. The sun is more responsible for damage aging, and disease than our genes. And the easiest way to protect our skin is with sunscreen. Besides using sunscreen daily, use products with ingredients such as antioxidants and serums to help feed and hydrate your skin tissue. Protect your skin from inflammation and free radical damage. In addition, your skin needs to be well moisturized to protect it from the elements. For anti-aging, it's a good idea to use something with a retinol in it that can help to smooth lines and prevent some wrinkling, while rebuilding lost collagen as the body's metabolism slows down. Also, to remember to eat the right foods, although what you eat doesn't affect your skin as much as some people think, unless you have an allergy. If your skin is being affected by what you're eating, remember it's the largest organ in the body, and you're affecting the rest of your organs too. Big question, what skin type do I have? Easy answer, look at your pore size. Small pores, dry skin. Large pores, oily skin. Most people have a combination oily, combination dry. At night you can swap out your serum for something that like a retinol or an antioxidant serum in the morning, such as a vitamin C. How often should you exfoliate? Once or twice a week, not more often than that, because as I've stated in previous videos, that will create a callus type of an effect on the skin tissue and do the exact opposite of what you're trying to do by exfoliating to begin with. You can also use a light chemical peel such as an AHA. My recommendation is that you mix it up a little bit as far as a physical exfoliant and a chemical exfoliant. A physical exfoliant would be a scrub. A chemical exfoliant would be something such as an AHA or a retinol. How often should you see a dermatologist? It's recommended at least once a year for cancer screening. How often should you see an esthetician? It's recommended once a month. Although that seems excessive in America, I've found, even though that's the protocol that European women use, and they have beautiful skin. Usually with my clients, I recommend 1 to 4 months, 3-4 times a year at least. So see a dermatologist if you're having any kind of a skin concern, or immediately if you're having a change to a mole, or you see a mole with an irregular shape, tri-colored, or just a change. Another thing people don't realize is that you could have a type of skin cancer that looks more like a blister. It's a little bit itchy, it has some white fluid to it, but there's really no color. Basically, if you have a skin condition that does not clear up, you should see a dermatologist. Also, always check under your arms and not just in the breast tissue for any types of lumps. That means your lymph glands are swollen, and that will happen quite oftentimes under your armpit and around your neck, in the back, and your throat area. Make sure that you check on that. If you feel any hardness and lumps, absolutely see a physician as soon as possible. Which areas of the body should you pay more attention to? All of your body, not just your face. Quite oftentimes, people will get skin cancer on not just their nose and their ears, but also their legs. Again, that has to do with sun exposure, and you want to make sure that you're wearing a sunscreen every day, even when it's cloudy. What's the best age to start skincare? I think as soon as possible. It's a good idea to get a child into a routine as early as 9 or 11, even with just a nice gentle cleanser and a nice hydrator. The sooner the better with the skin care and protocols. Similar again to brushing your teeth. Once that child has teeth, you want to make sure that they're clean. It's never too early to start with taking care of your skin and starting some kind of a skin routine and body routine for cleanliness and health. What's the best way to treat dark spots? This, my friends, is a huge question. There are doctors who specialize in this alone. First of all, not all dark spots are created equal. The best treatment depends on what created the dark spot to begin with. Some are classic sunspots, which we can treat with lasers or retinols or AHAs or even microdermabrasion. Personally, I have found through the years that if I mixed it up and I did different things at different times during the years or within my skin routine, that was the absolutely most effective. Nothing is a one-time shot and it's gone forever. This is a continual process because you are having continual damage to your skin. So you want to always work on making it better. Can you use a retinol if you have sensitive skin? That's a really good question. Retin A I have found with my skin because I have an inflammatory disease and rosacea. I have found that strictly using Retin A from a dermatologist exacerbates that condition. I have formulated a product that is a healing serum. It has some very gentle retinol from a natural source, but it also has hyaluronic, calendula, aloe vera, things that hydrate the skin and help the skin create more cell turnover, but in a very gentle way. What's the best way to exfoliate if you have acne? When it comes to exfoliation, lay off the scrubs if you have chronic cystic acne. Try using an AHA or a gentle peel combination with lactic glycolic and light salicylic. If you have oily skin, do you need to moisturize? Absolutely. Oily skin needs a moisturizer or it will create more oil. Think of it as hydrating. Use a light moisturizer, and my favorite ingredient is the hyaluronic acid, which holds 1,000 times the amount of moisture. It's like putting water on a sponge and it just fills that sponge right up, but there's no oiliness to the texture at all. What is a serum? Serums are special because they are formulated with smaller molecules of concentrated ingredients, which makes it possible for them to penetrate into the skin tissue at a deeper level and deliver more active ingredients than other skincare products. A serum is one of my personally favorite products. It's a great idea to use a serum at night when the skin is at hard work repairing itself. Actually, our whole body goes through an internal cleansing process. It's important to prep the body with good skincare before you go to bed. And they have found that people who take a shower before they go to bed will have less allergy symptoms for seasonal allergies. Why is my skin dry? I'm always moisturizing. First of all, if you're not exfoliating, you have this layer of dead tissue that cannot absorb and the product cannot penetrate through. Second, you could be using the wrong moisturizer. It's best to see an esthetician and let them recommend your product. Those are all the questions I have. If you have more, please comment down below and please subscribe and like for future tutorials. Thank you for your time, and remember, the sooner you start with good skincare, the better. Go get your glow.